is pemphigus and pemphigoid. To differentiate these two disorders, you can look at the age of onset. The age of onset in pemphigus is 40 to 60 years, while in pemphigoid it is 60 to 80 years. The second is, look at these blisters. These fluid-filled lesions or the blisters which are seen in pemphigus, they are flaccid. As I already told you that they easily rupture, and when they easily rupture, what they form? They form erosions and crusting. So here in pemphigus you will get flaccid blisters which easily rupture to form erosions with crusting, while here in pemphigoid the blisters are tense, they do not easily rupture. And when they do not easily rupture, what happens to them? They keep on increasing in size and they become very big. And with time, this fluid get reabsorbed back into the skin, and this overlying epidermis gradually settles down, leading to settled blisters. So settling down of the blisters is seen. There are few more differences which can help you differentiate pemphigus from pemphigoid, and these differences are very easy to remember. Why? Because I am going to give you a mnemonic here, and the mnemonic is Minar. Now all of you know that Minar is present where? Like Qutub Minar, it is present in Delhi. Char Minar, it is in Hyderabad. Where is this Minar present? So this is the mnemonic, that is Minar is present in pemphigus, while it is absent in pemphigoid. So remember that this is the mnemonic to remember the differences between pemphigus and pemphigoid, and that is Minar is present in pemphigus. What is Minar? Mucosal involvement. Intraepidermal blisters. Nikolsky sign. Acanthocytes. And row of tombstones appearance. All these are the features which can be seen in pemphigus, they are not seen in pemphigoid. So if a question comes in your exam and in that question any of these is mentioned, that is mucosal involvement, intraepidermal blisters, Nikolsky sign, acanthocytes, or row of tombstones appearance, then remember that the examiner is talking about pemphigus and not about pemphigoid. There is one sign which is known as Bullous spread sign. Now this is not very characteristic because this is seen positive in both. Still sometimes they mention Bullous spread sign. So just remember that if this is the blister and if you apply perpendicular pressure to this blister, what will happen? This blister sometimes extends circumferentially. So on all the sides it will extend. This is Bullous spread sign. Or if this is a blister and if you apply pressure on one side, this bulla extends on another side. This is known as Bullous spread sign. Okay. Now, when the bulla is very large, what we do? We generally do this. That is, we apply pressure on one side. Before applying pressure, you should mark the edge so that you know that how much extension has occurred. So you mark the edge of the blister, then apply pressure on one side, and you will see the extension of the bulla on the other side. This is what? This is Bullous spread sign. So this is Bullous spread sign. But sometimes the lesions are very small. They are vesicles. So if they are very small, you can apply perpendicular pressure, and when you apply perpendicular pressure you can see that it is extending on all the sides. This is also known as Esbo-Hansen sign. So this is just a variant of Bullous spread sign, also known as Esbo-Hansen sign, but remember that this is not characteristic of either pemphigus or pemphigoid. It can be seen positive in both. Okay. Though there is one slight difference, that when you apply pressure on one side, the extension. So let us consider this is the bulla, and when you are applying pressure on one side, so when you apply pressure on one side, you will see a triangular edge which comes out on the other side, while here in pemphigoid a round edge comes out. So this is a slight difference, but never question have been asked. So just remember that it can be seen positive in both. It is not characteristic of either of them. Ninth is DIF. So I already told you that direct immunofluorescence is the investigation of choice for immunologically blistering disorders like pemphigus and pemphigoid. And if you do DIF here, you will get which pattern? Fish net like pattern. So fish net like pattern is seen. While here a linear pattern is seen. Now why fishnet like pattern is formed? This is formed due to intercellular means in between the keratinocytes. So in between the keratinocytes, intercellular. So due to intercellular deposition of which antibodies? Anti-desmoglein antibodies, which is against desmoglein 1 in foliaceous and which is against desmoglein 3 and 1 both in vulgaris. While here linear pattern is seen. Why linear pattern is seen? This linear pattern is due to IgG and complement deposition in basement membrane zone. Let us try to understand the difference, but remember this pattern, that is fish net like pattern, which is seen in pemphigus, while linear pattern is seen in pemphigoid. Why this is happening? This one I have already explained, that these are the keratinocytes. So within the epidermis, the antibodies which are formed, they are formed against desmoglein. So they go and deposit here in between the keratinocytes, leading to these fish net like pattern. But in pemphigoid, what is happening? That if this is the section of the skin and this is epidermis and this is dermis, what is in between? In between is basement membrane zone. So let us consider that this is the basement membrane zone. And both these antigens, that is BPAG1 and BPAG2, that is Bullous Premphigoid antigen 1 and 2, they are present where? They are present here in basement membrane zone. So the antibodies which are formed, these antibodies which are formed, they will go and deposit where? Where this antigen is present, that is BPAG1 and BPAG2, that is in the basement membrane zone. So all these deposits take place in basement membrane zone, giving rise to this linear pattern. So this linear pattern is seen by due to deposition of this IgG antibodies where in basement membrane zone. Okay, so you can see the difference on immunofluorescence. Here you will get a net-like pattern, while here you will get a linear pattern. This is in epidermis, this is where in basement membrane zone. If you do histology, I already told you that acanthocytes are seen and a row of tombstones appearance is seen. I already explained what is that in pemphigus. But in pemphigoid, subepidermal split occurs. So the split or the separation is occurring where? Below epidermis. So subepidermal is split with eosinophilic infiltrate. So subepidermal split with eosinophilic infiltrate is seen in cases of pemphigoid. The last point is treatment. Now, like pemphigus, pemphigoid is also immunologically mediated. Here also antibodies are being formed. So here also immunosuppressive drugs are needed. So we give steroids. So steroids can be used. There is also role of tetracycline. Now you might be wondering that tetracycline is antibiotic. Why we are using it here? Because tetracycline have one more property. It is anti-inflammatory drug. So it reduces the inflammation, and due to this effect, it is used in cases of bullous pemphigoid.